Dennis Mariano here. Thank you for attending our Transformational Healing Seminar. And our goal this evening for you, as usual, is to present to you information that will help you think a certain way. In today's world, challenges we have, the reason why people die, it's not because of disease or heart disease or cancer or accidents. The reason why people die is they make bad decisions. And our goal is to help you find information and also principles that can help you with making good decisions in your life so you can live a thriving life. Our topic this evening, before we get started, is how holistic healthcare can help me with my chronic pain and health problems. If you have any questions, those of you that are online, please type it into the comment section, and so this way we can answer those for you later on. To share with you our practice mission statement, we are here to provide you with the best technology in holistic health and life care. And our catalyzing statement is to inspire people to live thriving lives so they could be a beacon of hope for others. So with regard to holistic care, most people don't really know what that means. It's a buzzword that people throw around, and many times our experience is that it's just a buzzword, but people can't really deliver. So tonight we're going to be discussing the principles on what that means. What exactly is holistic healthcare? Well, in order to be healthy, there are three major components that you have to apply with regard to either being healthy or being sick. If you become sick, there are always three components in general that apply that have been broken with regard to the principles. For example, you can have chemical stresses, emotional stresses, and physical stresses as well. These three components in combination, when they become overwhelmed, can create disease in your body or your body's lack of capacity to adapt. It's never about the viruses, it's not the bacteria, it's not the stress. People go, it's stress. It's not that, it's how you react to those stresses and how you adapt to the bacteria and viruses. It's always a dance between the environment, external environment, and the internal environment. It's never one and the same thing. We obviously can't always control the external environment, but we can control the internal environment and also our reaction to it. And that's really what we're going to be discussing this evening, is what things can you do as a human being to be able to adapt to the environment so you can live a life of thrival instead of just constantly struggling. The first component is the biochemical stressors. So therefore, in our practice, what we do to analyze if there are any stressors that are biochemical in origin, we actually do functional blood work, meaning the kind of blood work that we do instead of the traditional model where people, traditional doctors will look at labs to look for a disease. Our labs actually are where we look at how healthy the body is or how out of balance it is. And our goal is not to treat a disease or to fix a number on that lab, but to actually allow your body to be more balanced so it can adapt to the environment. Because this can actually lead to nutritional deficiencies that can influence the way your body works. Also, there are a lot of people have gut dysbiosis or infections in the gut as a consequence of malnutrition and also being exposed to different chemicals in the foods that we eat and the water that we drink as well. Because of stress levels in our life, a lot of times we actually have adrenal insufficiency or adrenal exhaustion, and we also do cortisol levels by doing saliva testing. And hormonal imbalance is rampant throughout this world. And it's not so much because of age or menopause, even though that contributes. You'll find countries such as Japan and so on that have less of these imbalances because they live a more natural life, because they're more of an ancient culture. And people that live in a more holistic manner don't really suffer from these consequences. But we do have measures that we could do, implement in order for us to find out if there are any imbalances hormonally. So detoxification is really important. When we do hair analysis, we usually find that a lot of people have issues that are coming through their hair as a consequence of poisons in the environment. And many people have metal toxicity. Again, the gut needs to be healed. We use dietary changes, nutritional supplements, and also homeopathic. But instead of just using those separately on their own, on a guessing level, we actually use the labs to substantiate if you need to have any type of intervention. So biochemical stress study, yeah, so one of our patients had some issues with regard to chronic headaches, having to use medications to try to suppress those symptoms on a regular basis ever since she was 20 years old. And through the work that we've done, and it took us maybe a year and a half or so, using spinal balancing, chiropractic adjustments, removing stress from the nervous system, and also we checked the adrenal glands, and also we found a lot of heavy metal toxicity in that person. So by balancing the biochemistry, naturally, safely, that person was able to then live a healthier life, and was able to, with their doctors, coordination with their doctors, is to be able to get off their medication and live a healthy, drug-free life. And if you haven't noticed yet, if you think about this, emotional stressors are a big factor in today's world. We live in a world that's extremely stressful. And there's two types of stresses emotionally. There's the psychological stress, and there's also the neuro-emotional stress. And we'll actually discuss the difference between those two. So psychological stresses, if you think about it, they're basically experiences that we have in life that are either unresolved or triggers our past history, relationship issues, and so on. And those are more situational, and that's where the benefit, you could benefit from approaching that with a counselor or a therapist to help you work through these things on a cognitive level. The other component that we take care of in our practice is basically what's called neuro-emotional. And if you look at this chart, this is called the NET chart. In Chinese acupuncture, they found out that organs in the body hold emotions. Dr. Candace Burt wrote a book, The Molecules of Emotion, and substantiated this in a more scientific level, showing that neuropeptides, or molecules, hormones, actually travel from your organs throughout your body, to your brain, and to different organs that are actually affected by emotions. And so if you think about, for example, if you look at the gallbladder and liver meridian, you'll see here that those are affected, associated with anger and resentment and frustration and depression. So if somebody has these emotions on a chronic level and they're already doing therapy or doing counseling, and this part of the intervention can benefit because it's more a body physiology issue rather than just a cognitive issue. And if you look at the large intestine, lung meridians, you have emotions of grief and dogmatic positioning and sadness, yearning, cloudy thinking. So those can need to be addressed as well. And you have the stomach, the spleen, and the pancreas have emotions of oversympathy, low self-esteem, lack of control over events, living through others. So there's a lot of different emotions associated with these different organs. And you can look at the endocrine system as well. So a good case study about this was, there was a lady that came to us from a different area of our state, and she was referred to us by one of our chiropractic doctors, that she had already had low back surgery 10 years prior, but she was still having challenges as a consequence of not being able to really do anything and being still in pain. So what had happened is, through our analysis, we were able to determine that most of the issues that she was experiencing were actually neuroemotional in origin, meaning that the pain that she was experiencing that was chronic, even though she'd already had surgery, she was already under chiropractic care, and she was doing exercises, was not able to be relieved because the problem was basically in her physiology. And the good news about that is we were able to actually help her. It took several months, but over time she was able to have resolution to her pain, and most of it was not even spinally related. It was actually neuroemotional. And those of you that are interested in what that means, we'll have a seminar that's separate to basically show you what NET is all about. We'll have a demonstration with that as well. Physical stressors. The most important thing about physical stressors is that when we experience stress in life, it affects our physical body. The physical body, as you know, is made up of organs and muscles, ligaments and tendons, and so on, and hormones. The thing is, it's run through your nervous system. Your nervous system controls every organ system in the body to adapt the body to the environment. So if you think about that, look at Gray's Anatomy. It says what controls body function? The brain and nervous system control the function of all tissues, organs, and systems in the body. And here's the key: to adapt to the environment. Without your nervous system, it's hard to adapt to stresses in life. So when you have issues, for example, let's say this is called safety pin cycle in chiropractic. If your brain and nervous system are talking to each other consistently, then you have 100% function, because the brain cells, the energy from the body communicates to the cells and tissues and organs. If you have 100% connection, there's 100% function. However, when we have stress in our lives, physical, emotional, or chemical, otherwise, it creates stress in the nervous system, and consequently, then it inhibits the expression of life in the body, because then the communication becomes disheveled. And Dr. Chung-Ha Soo, back in a long time ago, 40 years ago, in the University of Colorado, did a study, and he found that even the weight of a dime on a nerve will decrease the function of that nerve by 60% within 2 minutes. So when you have these subluxations in your spine and you're not aware of it because you have no symptoms, it's actually influencing the function of your body as well. And a study back in 1921 shows that Dr. Henry Windsor, he was a pathologist. He would study people that have died of many different causes, and he found that whatever that person died of, that part of their spine had associated with the nerve and the organ actually had the most amount of scoliosis, a small scoliosis, or the most amount of arthritis. And that tells you then the equation is that when you affect the spine and nerve system, you affect the function of the nerves, you affect the function of the body, and you affect your health as well. Because ideally, you should have optimal health and function, but as you get exposed to physical, emotional, and chemical stress, the misalignments in your spine begin to accumulate, and without correcting those, it affects your nerve system function. It diminishes the body function over time. The body begins to malfunction. You lose your health, and then eventually you have symptoms. The problem is when you have symptoms, that's really the last thing to happen. If you see on the bottom here, it's the last thing to happen, and it's not the first thing. What needs to happen is you need to allow your body to get up to the top part in order for you to be healthy. Some of the tools that we use, one of them is the Zirconia laser. That's one of the tools that we have. And what it does, it provides you with many different benefits. It emits a visible, coherent light. It stimulates the body's ability to produce ATP, which is the energy of the body, and also allows natural healing in the body over time. It decreases pain and inflammation, and it increases natural range of motion, and it balances your cellular physiology. So some other effects of the laser are increases white blood cell function, it increases the tissue uptake of oxygen, increase axonal regeneration of nerve cells so the nerves can repair themselves, and it upregulates cells in the lasered area as well in order for it to function in a higher level of intensity. It also stimulates lymphatic flow, so the lymphatic system can flow much better with by applying the laser. And again, we talked about the mitochondrial ATP being stimulated by the laser as well, and it modulates the cortisol levels and creates an anti-inflammatory effect in your body by applying it too. And the bottom line is it really gives you better clinical results, because using the coherent light, using the photons that are basically particles of subatomic particles, you're able to influence the body's physiology without harming it, because it's a cold laser. We use it as well to do upregulation. There's a thing that Dr. Spencer taught us where you can upregulate the body so the adjustments can hold better, because the software portion is better, is actually functioning well with the laser. We also do functional movement taping as an adjunct to the adjustment. Once the adjustments have been made, we can use kinesio tape by doing an assessment to see where we can actually create more stability in the body temporarily until it can regain its own strength. These are some of the athletes that we worked with. These are the Harlem Wizards. This was several years ago when I had the honor of working with them as at the gym in Conestoga High School. So basically, the analysis and correction of asymptomatic subluxation is critical for your health. See, a lot of people think that chiropractic, think about that, ask yourself this question. Isn't it true that most people believe chiropractic is for symptoms, headaches, back pain, and so on? Well, that may be true with regard to its effectiveness in a natural way to be able to help people without use of drugs and surgery. However, that's not what it's about. Chiropractic is really about the functioning of your nervous system. Your capacity to adapt to the environment is all run through your nervous system. When you have pressure on the nerves in the body, your body goes into sympathetic dominance, meaning you go into fight, flight, or fear. When you're in fight, flight, or fear, you're not able to be in healing and repair. So you have to pick one or the other. You're either healing and repair or fight, flight, or fear. And what the chiropractic adjustment does by analyzing these subluxations in the spine, it removes the interference in the body so the body can then begin to repair itself. And what we do in our practice as well, we do some muscle testing so we can prioritize what the issue is. For example, you can have a problem, stomach digestive issue. You didn't need to be able to analyze, is this biochemical? Is this what you're eating? Is this a nutritional deficiency? Is this subluxation from the middle part of your spine, the T5 area, that can create distortion in that area? Or is it neuroemotional? Because the gallbladder liver meridian can actually affect the digestion if you have emotional stresses that the body's not able to release because they get stuck in the system. So a great example of this is a study where we had an 11-year-old child come to our practice who's been a chronic person, who had chronic issues with the immune system. They were always sick, always going to the doctors, taking antibiotics every couple of months or so, and they've been doing this since they were a very young child. So with our type of care, we were able to actually provide supplementation to heal that person's gut, because the gut's 80% of your immune system. And also we were able to use chiropractic adjustments to relieve tension in the nervous system to allow the body to adapt. If you really think about the chiropractic adjustment, it's not just adjusting the spine. When you adjust the spine, you send signals to the mechanoreceptors and proprioceptors into the spinal cord, up to the brain, and what really happens is your brain makes new neuronal connections in order for the body then to look down on itself and to begin to heal things. And that's what the chiropractic adjustment does. But if you haven't been adjusted for ever since you were born, then you already have a lot of deficiency and maladaptive tendencies, so the body's not able to function the way it's supposed to. But fortunately, with the kind of care that we provide, the safe health care, holistic care that we provide, we were able to help this child, and they actually were able to not only do better in school, they became less and less sick, they were off their medications, and they were also able to actually participate in sports because they were feeling a lot better and they were no longer sick all the time. If you were to expand on the 3 components, physical, emotional, chemical, you actually can also expand that to 6 components, and the holistic approach now becomes physical, structural, biochemical. EMFs are everywhere now, especially with the technology we have with the cell towers and so on, and also it affects us. The Wi-Fi's around us, and those are all subtle energies that the body was never meant to be exposed to because it's man-made, and that can stress our systems as well. Again, toxicity in the body is a big thing. You can become toxically overloaded, and also allergies and infections can be rampant in the body, can affect that as well. And emotional stress, we've already discussed that. So those 6 components, think about these things as buckets. If these buckets are full, you will not be healthy. You will have pathologies, you'll have sicknesses. If you empty these buckets over time, and the body then begins to heal, because you can have a clean system. There was a study, I'm just joking about this, but this is a study from boosting your immunity with Dr. Perot, and he basically was a cancer researcher, and he found that when people were under chiropractic care, he took a cancer group that were under care, were not under care, but they had a clinical diagnosis of cancer. They measured their immune system. There are 22 different parameters. Two of them were, one is glutathione transferase S, which is an enzyme that if you have high levels of that, you can adapt to toxicity in the environment. And there's also unscheduled DNA synthesis is the second one. So if you have your DNA damaged and your body can repair that, your immune system will be stronger and you have less chance of actually have bad genes and also bad cells, which can turn into cancer. So we measure these factors in terms of the people with cancer, clinical cancer diagnosed by the medical profession. The control group had no cancer but no chiropractic care. The chiropractic group was chiropractic care with no cancer over a period of 5 years. And what he found was pretty stunning. He found that the chiropractic group actually had 400% greater immune competence than the people not under chiropractic care that had cancer. And it also had 200% greater immune competence with the people that didn't have cancer but were not under chiropractic care. So again, what it showed is that the immune system, and you'll find in the next slide here, also there's some other studies that show that surrogate indication of the body's serum thiol, where the body is able to adapt to more stresses in the environment by being under chiropractic care as well. I love this article, even though it's older. It's actually from 2016, and this is from Discovery magazine. They said they'll have to rewrite the textbooks because, listen to this, it said it's a stunning discovery that overturns decades of textbook teaching. Researchers in the School of Medicine have determined that the brain is directly connected to the immune system with vessels previously thought not to exist. Think about that. They thought that it was all mapped out, right? So I really did not believe there were structures in the body that we're not aware of. I thought the body was mapped, said Jonathan Kipnis, a professor of Department of Neuroscience and the director of the University of Center of Brain Immunology and Glia. He goes on, how these vessels could have escaped our detection when the lymphatic system has been thoroughly mapped throughout the body is surprising on its own. So that just again validates to us that the brain and nerve system is all one and the same thing. And that's why when people come to our practice with different types of ailments, we're not here to really cure anyone or take care of those ailments. We're here to allow that body to be balanced so the body can adapt to the environment and it can begin to heal. So the future, you need to really be able to learn that you need to trust that the body is intelligent and the messages from the brain to the nervous system run through that intelligence. So don't merely rely on your only on your physical senses to gather information about your health, because how you feel is not a good indicator. By the time you feel something, many times that's an effect of what you've done in the past. If you think about subluxation, that's a term in chiropractic that shows you that the spine is not broken, but it's misaligned, putting pressure on the nerve. But if you break down the word in Latin, it also shows it's sub, less than, lux, or light, Asian, or a condition of. So subluxation is not only a physical entity of neurological stress in your body, but it's also a condition of diminished light. And who wants to be diminished in their function? Again, what you see in front of you is only a small part of the whole. The whole is greater than the sum of its parts. It's not equal to the sum of its parts. Just remember that. Who you are is more than what you see in front of you. Even though we don't get yellow jerseys like they do in the Tour de France after the grueling several weeks of competition, I believe that we all deserve to have the benefit of holistic care so that we can live lives and live our mission here on earth that God gave us. Again, to close, is our mission statement is to provide you with the best technology in holistic health and life care. And we're here to inspire you to live thriving lives so you could be a beacon of hope for others. If you're online, please like our page on Mariano Holistic Life Center, and also Dr. Dennis Mariano, no space between the doctor, on Facebook. And we're on YouTube as well. You're probably watching this on YouTube as well, and on Facebook, and we're also on Instagram. Again, if you have any questions, type them in the comment section so we can answer those for you. If you found value or were inspired by anything that we discussed with you this evening, please give us a like and a comment as well. And those of you that have friends and family that need to hear this information, please share this with them and tag them on this so that they can benefit from this as well. If you yourself are having challenges, please give us a call, connect with us so that we can create a community here in our practice, in our community, so that we can help each other and support each other. Our website is drdennismariano.com, and our next seminar is Let Your Body Be Your Guide, and that's in 2 weeks. We don't have a seminar next week, we have this coming week, and it's Learn How to Muscle Test, and that's really a big one for our new patients. It's a foundation of what we do in our practice. December 3rd, 2019. Let's close now. So I want to close with this poem. I went to the woods because I wished to live deliberately. I wanted to live deep and suck out the marrow of life, to put to rout all that was not life. So when I came to die, discovered that I had not lived. And that is by Henry David Thoreau. Many of us live lives of quiet desperation where we're always waiting for that important thing to happen. I would urge you to take a stand, to have good boundaries in your life, and to really look at it, because tomorrow is not promised. You never know what could happen. That tomorrow is not promised. That live your life the best that you can so that you can have a life based on your mission, that to help others live a better life as well. Thank you again for joining us this evening. I'm Dr. Dennis Mariano. Until we see you in the next video, have a good night. Take care.